Hi everyone, Dr. Brian Stenner here at Wilkins Spinal Care in Mount Pleasant. Today is a very sad day because this is the last video blog that we're going to do that my shoes aren't going to be on. So it's kind of sad for me because this is very comfortable. But the exciting thing is we're going to have more topics in the next coming weeks that's going to be very fun to talk about. So this week we're going to talk about shoes and orthotics. So first off, let me give you a baseline of shoes. Shoes are very important because they protect our feet from different things, bug bites and inanimate objects you step on. But the most important thing is they're good for support. That's the biggest thing that's important about a shoe. You want to find a shoe with good durability, good stability, and really good support. So when you're looking for a shoe, there's these big names out here, Nike, Adidas, Reebok. Are they the best shoes to have? They have good products for sure, but not every product is good. Some shoes are meant for shock absorption. Some shoes are meant for working in hard labor. Some are meant directly for sports. So you want to make sure you're finding the right shoe for the activity that you're using. Now, how do you find that right shoe? You got to do your research. You want to find a shoe that has really good arch support. You want to find a really good shoe that's good for pronation, supination. If you don't know what pronation and supination is, this is pronation, what I'm doing with my foot right now, and then this is supination. So inversion, eversion, there's the different couple names if that's one thing that you might know it better by. So find a good shoe, and you got to do your research on it. So I'm going to show you my shoes real quick. These shoes I don't wear anymore. I'm going to come up to the camera lady here. This is how you know when a shoe is worn out. Biggest thing you want to do is you need to change your shoes out as often as you can. Some shoes you need to change out every 3 months, some you need to change out every 6 months, some might be a year. It just depends on the activity that you're doing and how harsh it is on your feet. So if you look at my shoes here, I use these for my shooting events. There's tears in there. If you look here, there's tears in here. It's getting worn out. You can see I have a stone in there that I just noticed now. So those are bad pairs of shoes. Those shoes don't have a lot of support anymore. They don't have a lot of stability. Now these are my work shoes. These are pretty brand new. I got them a couple months ago. They're a little dirty, but other than that, you don't see any tears in here for the most part. You see all that structure in there. It looks pretty strong. They're suede, so the color's starting to fade out a little bit. You gotta clean those up a little bit. But those are good shoes. You don't see really much any wear and tear on them at all. And how do you determine if a shoe is good or bad? You want to look at the heel. Sometimes if you're seeing a heel that looks different, might be time for a new pair of shoes. Again, it just depends on your activity level, whether you do it 3 months, 6 months, 1 year, it just depends. Another very, very important thing, make sure you find a shoe that fits you. Okay, some people buy shoes that are too big or too small. That's not good, because if your shoe's too big, you can roll your ankle, you can fall, and you can break something. If you have a shoe that's too small or too tight, that can restrict your blood vessels, and then you can get a lot of numbness in your feet. So that's the important thing about shoes. Moving on to orthotics. I'm actually going to show you how we fit patients here for our office here, and then I'll explain our orthotics afterwards. So here's how it works. You find your cup of your heel right here, and I'm actually going to have the camera lady come a little bit closer. She doesn't need to necessarily look at me. I'm just going to have her look at the feet. So you find here, first you find out what your size is. And then once you do that, you put a patient in a slight bend in their knees. And I'm actually going to bend down real quick and push these buttons here. So you slight bend in your knees, okay? And what you want is that lacer to go to your second toe as best as you can. You're supposed to have your socks off. I don't, obviously. But slight bend in your knees. You want it to go to your second toe, to your knee, like just where it's at, center of my knee, based off of what I'm seeing right here. And it will go up to your hips here. So for the most part, if you look, my left leg's pretty good. My right one's a little off. But that will tell me a baseline what we're checking for, okay? So here's the biggest thing with orthotics. Orthotics, the biggest thing is arch support, pronation, supination, and pressure on the feet. Here's one other thing you want to pay attention to is comfortability. 50% of orthotics are as hard as a rock. Okay, I've felt them. I've had patients bring in bags of them. There's just no comfort to them. You want to find a pair that is good for comfort. Most of these orthotics out there have like a gel or a cushion, help with the pronation, supination, but it doesn't necessarily help with the rotation of the feet. That's where our orthotics come in. So I'm actually gonna have the camera lady come right over here, right to the back of the device here, and you can see these little clips right here. You have a white, you have a gray, and you have a black. And if you look, when I push these, if it will push, that just turned it. So based off of what I'm finding when a patient's on the scanner here, that tells me how much rotation I need to take out to get their foot leveled. So what happens is, just imagine, I'm gonna have you put the camera right here on my foot. Just imagine my foot. Say it's rotated this way. And obviously someone's foot's not gonna be rotated that much, I'm just exaggerating. When I'm rotating my foot, look what happens to my knee. My knee goes with it. My hip goes with it. And then that results in back pain. So my job with these devices are to get the foot back to level, take the rotation out, and get you out of back pain. So what I'm going to show you here are my orthotics. These are the little clips that go into the back of the orthotic here. These are what help take the rotation out of the feet. Okay? So we have 3 different pairs of orthotics here. We have red ones, we have yellow ones, and we have green ones. And is there a difference in all these? Yes, there are. So red ones are patients I give that are more leisurely patients. You know, they're not extremely active, but they are on their feet enough that they should be wearing a pair of orthotics. My yellow pair here, these are for more heavier duty kind of patients. You're more like someone who is an athlete, someone who has plantar fasciitis, someone who has Morton's neuroma, heel spurs, someone who is constantly working, someone who wears heavy boots, stuff like that. These are more for traction. Okay, so I give these a lot to people who are tennis players, golfers, you know, someone who's doing a high intensity sport that's doing a lot of traction motions. And actually a lot of golfers, PGA golfers, wear these specific orthotics, and a lot of NFL players play with these orthotics in. So a lot of people know Dr. Scholl's foot levelers. Do they work? Yeah, they do. We've had them in the office before, but they're not actually getting the rotation out. And what foot levelers, for example, will do is they'll take pressure off the feet. They actually do a custom mold. And yeah, they work, but I will say they are very, very expensive. These ones are very inexpensive. They're about half of what most orthotics cost. So they have a very high success rate in this practice. They've worked very well. I like the scanner because it actually shows the patient. I actually have a door that has a mirror on there that the patient's actually seeing exactly what I'm telling them. And that way they understand how their body's working and how their biomechanics have changed and what we're trying to do to get them to go into that correct position. So that's all I have for you guys this week. You know, like I said, find a good pair of shoes. I have a local shoe company called Gingerbread Running Man Company in Greensburg, and they also have a location in Indiana. I recommend their shoes. These pair that I have here are Ons. They sell them there. They have other brands like Hoka, Saucony, New Balance, you know, Brooks, you know, more brands that they're becoming more popular nowadays. Very good shoes. They actually show you how you walk and actually show you what shoe is best for you. So if you have questions for me, you know, I'll be glad to give you their contact information. If you have questions about my orthotics, you know, I'd be happy to answer questions. Or if you just want to talk more about proper footwear, I have no problem answering those questions too. Otherwise, one last week we're going to talk about feet. We're going to talk about heel lifts next week. But other than that, if you don't have any questions, you know, if you do, feel free to give me a call. Otherwise, I'll see you in next week's video.